we are at 5 cases at the moment. Are there any more, as far as you know?
Oh, good morning, Peter. No, my information is that we have those 5 cases as reported yesterday. We can expect to see more. We've got good surveillance at the borders with the measures introduced, and so we may well see more cases as we continue to monitor and test people. But 5 at the moment, all in isolation, which is good, and certainly no cases we know of in community.
Why press the pause button on the arrival of migrants and international students, even though they would be double vaccinated heading into a country that has very high vaccination levels?
Well, it is a pause, as you say. It's a pause for 2 weeks. What we don't know, we just don't know enough about this virus. So it does look like it's highly transmissible and infectious, and that's shown by the fact that it is spreading to a number of countries around the world, so not just in southern Africa. We're seeing now community transmission in countries such as Portugal, where initially we were seeing cases just in travellers to South Africa, and that's not unexpected. And we can expect to see the same here in Australia over time. So the pause is really to buy us some time to understand more about this virus, to really clarify how effective vaccines are against the virus. As you say, we've got high coverage of vaccine in Australia, which is fantastic, but we just don't know enough yet. So over the next 2 weeks, it'll be critical to understand some of those aspects.
Highly transmissible, but milder than previous variants. Is that a word that you would use to describe the new variant yet?
It is. Based on what we know, that certainly seems to be the case. I mean, and including our own 5 cases, they've all had very mild symptoms, if any symptoms at all. But again, we just don't know enough. There aren't that many cases yet reported. Ironically, we need to see more cases to understand more about the virus. But all indications show that, particularly in vaccinated people, the disease does appear to be mild, and we're hoping that that's what will happen over the next couple of weeks, but hope's not a strategy. So That's the reason really for the pause and the cautiousness until we do understand more about the virus.
Will 2 weeks be it, or do you think it may have to be extended?
So at this stage, the plan is for 2 weeks. So the reopening continues. It's a pause for 2 weeks. As we learn more about the virus, obviously if the early signs change in any way that's concerning, we'll have to consider that along with all the information and provide advice to government. But at this stage, it is 2 weeks, and that's as much as we can say at the moment.
OK. How long do you think it takes you to get all the necessary data, all the necessary information to be able to make a solid call on Omicron?
Well, that will be more than 2 weeks. So it takes a while. We'll get some early indication of how quickly it's spreading within 2 weeks. We'll get early indication of how severe illness is. Hopefully we'll get indication of the difference between that in vaccinated and unvaccinated people. We'll probably understand through some laboratory studies how the vaccine still works. The antibodies produced by the vaccine work against this virus in neutralising it, which again, whilst not confirmatory evidence, is sort of an indication about how well vaccines continue to work. So we're hoping we have enough information to inform decisions. We're not going to get solid information really for a number of more weeks around that. But we'll keep monitoring the information as it comes out and to inform our decisions as we go.
So if you don't have all the information within the next 2 weeks, then this initial 2 week pause may well have to be extended.
Look, I can't say one way or the other. All I can say is we will continue to monitor the information. As I said, ironically, the more cases that we see around the world, the more information we'll have. Now, nobody necessarily wants that, but we've been here before. So very early on last year, we made decisions based on uncertainty, and Australia really the outcome we've had with the pandemic we've been had a very good outcome, and we're in good stead to manage this new Omicron variant as well the same way.
OK, Doctor, just a quick one here to wrap up. Is there any reason for state premiers to keep their borders closed or close them if they've just opened them up, given what you know so far?
So that will be a matter for the states and territories, and as you know, National Cabinet's on this afternoon.
Yep.
They'll be discussing the reopening plan as we go. Again, it's too early for information at the moment. The measures at the international border will work to really slow the entry of this virus into Australia, and as we learn more information over the next couple of weeks. So.
Okay.
It's really a day at a time.
Dr. Sonya Bennett, thanks for your time. Appreciate it. We'll talk to you again soon.